Yes, sir, we are live now.
Good evening, delegates and participants. Thank you for joining Shield Connect. And today we are back with our series, Dr. Ritu Santwani ma'am, as a icon herself in today's her program. So, ma'am doesn't need any introduction, but let me introduce her. Dr. Ritu Santwani ma'am is an obstetrician and gynecologist, an IVF specialist, founder and CEO of 360 Degrees Healthcare Studio. And ma'am is also consultant at Inamdar Multi-Speciality Hospital in Pune and infertility test to baby specialist. Ma'am is also part of NUHS Singapore, co-founder of MAAM, board member of SWWC, and ma'am is going to take the topic Decoding Vaginal Microbiome. So I hand over the session to Dr. Ritu Santwani ma'am, and I welcome her on our platform. Thank you, ma'am.
Thank you, Nishant. Thank you, Sahiti. Thank you, Shield Connect, for providing the platform for our this weekly show. So, wait a minute, I'm just sharing the screen. So, friends, before I start, as of now, how many of you are seeing the patient with this? I think everyone is getting the patients with white discharge in our OPD. So, if what treatment you prefer and how you treat the patient, so let us make this discussion interactive. I think those who are joined can at least on their mic and can discuss. So I am able to see some friends have joined.
इतना ज्यादा नहीं हो रहा, एक दो दिन में कम हो जाता है, ये टैबलेट्स कंटिन्यू करे तो कल सुबह 9 बजे रिपोर्ट्स भी आते।
पूजा मैम,
सुबह 9 बजे
म्यूट योरसेल्फ।
ठीक है ना, इधर आ गए तो हम इधर।
पूजा, हेलो, हाय डॉक्टर पूजा।
So sorry, ma'am. I didn't know it was on.
Achha, no problem, Pooja. No problem, dear. It's not an exam. No issues. No issues. Huh? So, friends, those who have joined, let me know that how you treat. What's your modality of the treatment for patients of this vaginal discharge? What's the line of action you start? Let's make this discussion little interactive instead of showing the slides. What all of you say? Or shall I show the PPTs? Huh. No one is replying. Why? Dr. Rupali, Dr. Vinita? Okay. What else? Dr. Pooja?
Ma'am, yes, good evening, ma'am.
Yeah, hi, Dr. Rupali. Yeah, Rupali, hi.
Ma'am, yes, this is really a big problem for all of us because it is such a common problem, and the patients always say that they have a white discharge, and the problem linked with this is that they constantly have some backache and bony pain they have with this. I don't know how it is linked with this now, and I don't know what is the proper treatment for that. That how can is there calcium loss with this vaginal discharges?
No.
Okay.
No. Let others also reply, then I will tell. Yes. Hi, Renu madam. Good evening. Vinita, what's your opinion? See, Rupali, meanwhile, we will discuss this. No? See, Rupali, most of the patients complaining of backache, some may say, कि ma'am, क्योंकि हमको backache हो रहा है, इसकी वजह से हमको leukorrhea हो रहा है. Some says that due to leukorrhea, we are having a backache.
Yes.
So what happened? See, whenever there is an infection, of course, we know there is an infection, and sometimes it reaches up and it causes the symptoms like of PID. And due to PID, pelvic inflammatory diseases, the patient is complaining of pain. And sometimes the infection is so severe that the tubes get adherent to the uterus. It means adnexa can, or the ovaries can get adherent to the tubes. So or uterus से तो उस condition में जब PID में convert हो जाता है, then the patient complains of the backache. Yeah. Renu madam, hi. Good
Yeah,
evening.
hi. Yeah.
Renu madam, today we are discussing. I think instead of showing the PPT, we can discuss with each other.
Yeah,
What
okay.
ma'am? So
Yeah.
there is a, yeah. Madam is a very famous practitioner from the Kanpur, and madam is so humble, so knowledgeable. I am really honored that madam joins my sessions.
No, I'm really, I think I always get something new from your lectures.
Thank you, madam. Thank you so much. Ma'am, there is a one query by Dr. Rupali. We all are discussing. You have joined just now. That's a, Rupali, you can raise your question again. We can take the madam's opinion also. Huh?
Okay, ma'am.
Yeah.
Yes, ma'am. Good evening, ma'am.
Good
Ma'am, just I wanted to ask that, ma'am, generally the patients complaint of a backache along with that white discharge, and with the discharge there is no complaint. I mean, they don't have any itching, no foul smelling, nothing. Just a white curdy discharge is there, and no, they say जैसे चूने के तरह निकलता है, जैसे like lime, and associated with that there is a severe backache. So should we give just calcium, or is there any? What is the link between?
Yes. I think calcium, vitamin D, and now magnesium, they all help in this such type of backache. But as Ritu was telling, there may be PID also if it is infection. That can also be a cause of pain.
Yeah.
But yes, you are very right. Sometimes the patient is having discharge when you examine and they don't complain of discharge. I also sometimes find it, and very difficult to explain when there is really, we find some pathology and patient is not complaining of anything.
Very
So maybe vascularity is not that much that the discharge does not come out and it does not disturb the patient, but still it is there.
Very true. Very true. Huh?
No, it is sometimes there, but yes, patient is not complaining of anything and you just examine, so you find discharge over there. At that time, if it is better that we treat the discharge at that time so that it doesn't change into PID.
Yeah. But most of the patients I'm seeing, madam, they are coming to us in a very late stage. Very late stage. Yeah. Yeah. So, yeah, Dr. Asifa, please mute yourself. If you want to ask any question, that time you can unmute yourself. So, when the patients are coming to us for this treatment, of course, we are giving the antifungal, antibacterial, anti-inflammatory. And as the madam has mentioned, yes, somehow the vitamin D deficiency in everyone. Once we give this vitamin D, of course, the very good results we are getting. And magnesium also, these days lot of literature are coming for the use of the probiotics and use of the magnesium. Madam, you practice of giving of magnesium usually in your patients? Madam, you're muted.
This is why I also myself. Definitely I have started using magnesium now and
Okay.
showing good results.
Okay, ma'am, you use 150 mg?
Yeah. OD. I use OD only. One tablet.
OD. Yes, OD only. Yeah. I usually give in some of my patients for 7 days, 10 days. Some patients will get good results.
Yeah, definitely. That is only depends on the patient.
Yeah. Other friends, those who are joining now, see, today we are having a discussion mode. Instead of showing the PPT, we thought that we can discuss something regarding this. I will take PPT some another time. So, as the topic of today was the decoding microbiome. So, we all are seeing that lot of patients are coming with this white discharge. So, how many of you are giving the probiotics in these cases?
I think everybody wants to be giving it because now it is definitely, and it helps also.
Yeah. Anyone is in differ in the opinion? Dr. Pooja, Dr. Rupali, Dr. Asifa, Dr. Neelam has joined now. Dr. Krati, is everybody giving probiotics?
Yes, ma'am, definitely.
Okay. Only with some probiotics, the cost is a factor. In some brands are very costly of the probiotics. But of course that, yes, but of course these show the very good results. So now coming to our next very important question.
Ritu, I just want to add something also.
Yes, ma'am. Yes, ma'am.
If soda bicarb wash,
Yeah.
that also affects.
I'm going to. मैं वही बोलने जा रही थी मैं वहाँ पे. Okay.
I have received that soda bicarb because it also maintains the pH.
Yeah,
So
yeah.
that is also very, it is free of cost. It is just a kitchen thing. So
Yeah, yeah.
It works.
Okay.
Also, some, ma'am, excuse me, some rice water wash. Also, some patients say it's very good for them in Candid, I think.
Yes.
Mm.
कल मुझसे भी एक पेशेंट ऐसा ही डिस्कस कर रही थी रूपाली कि yes they are using
पानी से ना चावल के पानी से धोते हैं तो अच्छा रहता है.
And have you searched about the logic that why they are using this rice water?
I don't know, ma'am. The starch in that.
Yeah.
That starch in that rice, I think that must be alkalining the pH.
Let's go and find out. Let's find out. मैंने भी नहीं देखा है. मैंने कल ही मुझे एक पेशेंट ने बोला था. तो I was also trying. Let's see. If anybody knows about the logic for this, please share with all of us. Always remember, knowledge always increases by sharing. The more the discussion, more we are benefited. Yeah, Dr. Asha has just joined. Acha, my friend has joined from there. Yeah. Dr. Frigura, Elena, welcome. Hi,
Hello,
Dr. Asha.
hello.
Hi.
Good evening.
Good evening. How are you? How are you? So now coming to the another point, some patients say कि उनको कर्ड वॉश के लिए बताया गया है. Ever you have heard? बहुत सारे पेशेंट्स बोलते हैं कि कर्ड के साथ वॉश करेंगे तो हमें जहां हम दिखा रहे थे. Sorry, we will speak in English because some of our other friends have joined. Some Alina, today we are discussing. We are having a discussion mode. So today we are discussing all these things, not showing the PPT. So some patients may say, yes, when we do the curd wash, we are only sometimes benefited. After that, again, the problem starts. So has anybody have heard or anybody has used for this? Anyone? Yeah. Hi, Dr. Chinwe. How are you? He joined from the Nigeria.
Yes, I'm fine, from Nigeria.
Lucky.
So friends, now coming to the next thing. So how many of you believe for the treatment of both the partners once the patient is coming to you with the leukorrhea? How many of you are giving the treatment for the both? And how much? Yes. And how much is the patient acceptability? See, because I am practicing in Pune, most of the patients are coming that they are in the live-in relationship, not the husband-wife. So it's sometimes very difficult to convince them, and we also don't know that who is having the multiple partners. So is all are agreed for giving for both the partners? Madam, you want to add something? No, madam, you want to add something?
Definitely, I always prescribe for the male partner. So,
yes.
And I always get, if it is a candid infection, blood sugar of both the partners.
Yes. See, madam has added one very practical point for the blood sugar. Yes. So yes, everybody is ready for the that everybody is giving for both the partners. Yes, very true. Yeah, blood sugar. So what are the basic investigations you are advising once the patient is coming to you with this white discharge? Is it some tests you are advising?
So,
anyone?
It is a fungal infection, definitely blood sugar. But then I usually give treatment if patient is relieved, it's well and good. If it is not, but if she is not relieved, then I go for high vaginal swab culture and
Correct.
That will tell you the type of infection, then you can accordingly culture and sensitivity is getting done, and you can antibiotics. Plus additional treatment like prebiotics, wash. If it is a menopausal patient, so it should be a wash.
Dr. Neelam, please mute yourself. Once you are speaking, that time you can unmute. Friends, request to all of you, once you are speaking, at that time you can unmute yourself. Yes, ma'am. Ma'am, see, there is one very important query has come. Friends, please participate actively. This is a discussion. So yes, as madam has also told, yes, if the infection. So I want to know is what's your plan of treatment once the patient is approaching in the OPD with the white discharge. After examining, you have found that it is a thick curdy discharge, and we are pretty sure that it is a candidiasis. So are you going to take the vaginal swab, or you are directly going to start the antifungal? I want the opinion of everyone. Anyone
I
can
start the antifungal.
Yes, yes. Because every patient can't afford the tests also. Yeah. Huh? Anyone is differ in the opinion? Friends, participate actively in the discussion, or everybody is starting the treatment first, and then if the patient is not getting relief, then sending for the tests. Ma'am, there is one query we had received. Is the patient, is there any PAPS? I think let me open the chat. No? So, is any pap smear is required? Not able to see. No, why pap smear is required before starting? I'm somehow not able to open the chat. Nishant, will you please help to read the questions? Somehow chat box is not opening. Dr. Nishant, are you
Okay,
there?
ma'am.
Yes, ma'am.
Nishant, can you please read the question? Somehow मेरे से में खुल नहीं रहा है questions का.
We received one question that do wet swab is required by Chinwe Igwilo, sir.
Again come the question.
Do wet swab is required?
Wet swab, wet swab.
Wet swab. Okay,
I will
okay.
have a swab, yeah.
Okay. Yeah, in some patients, if the patient is not responding to the treatment, yes, we of course advise for the high vaginal swab. Yes, but if your patient is ready, if patient is affording, then of course you can take the high vaginal swab. Till then, you can start the medication till the reports are coming. Other question also, मैंने कुछ pap smear का दिखा था निशान something. I was not able to find out that question. हाँ, अभी मिल गया मुझे. Okay. So now going for the treatment. So yes, this is, yeah. So starting with
one more question is there, ma'am. Is pap smear required?
So we have already answered. No. For starting, for giving this treatment, no pap smear, no, for this. Now coming to the next query, how many of you, how you start the treatment? Male partner to do urethra swab, you can do it, Dr. Chinwe, where we suspect some STI, some sexually transmitted infections. Of course, in that patients, yes, the urethra swab, of course, we send. In some patients, we send. And if the patient is affording, you can send it, not a problem. Because in India, we are seeing some patients who are with a very poor socioeconomic status. So in that patient, giving them the treatment for taking the medicines is also a big burden on them. So yes, as per the patient requirement, you can do it. Ideally, we have to send. Yeah. Now, other thing, how you diagnose that it is a trichomonial infection? And each and every one of us seeing the patient of the trichomoniasis in the OPD, anyone can write that what are the symptoms and signs? Yes, anyone can write that what are the symptoms and signs for this trichomonias infection, or otherwise how you are treating this trichomonias infection. We have just discussed about the candidiasis. We all know that Trichomonas vaginalis is also very common. What is one peculiar sign of the Trichomonas infection? This is just like, yes, very good. Yeah. So how we are treating? This is not an exam. We are just discussing. I think the discussion, once I start reading the PPTs, half are listening, half are not listening. So it's much better that we can discuss. And this is a very common thing. We are daily having the patients of this in our OPD. So yes, friends, let me know.
Metronidazole
Okay. You prefer metronidazole. Okay. And what dose you are giving, doctor? Meanwhile, some other friends have also joined. Yeah. Hi, Dr. Samuel. Yes. Yes. Anyone?
400 mg TID
Okay.
thrice daily.
Okay. Yes. Yes. Correct. Yes. Correct. Dr. Krati and Dr. Chinmay has written. Yeah. So for how many days you are giving? 5 days, 7 days? Huh?
7 days.
7 days. Okay. Can anyone tell me how much it is reported in the literature that for how many days we have to give? Though yes, correct, 7 to 10 days is the correct answer. So yeah, correct answer is 7 for Dr. Chinwe. Yeah. So usually once we are giving this metronidazole, we all know the metallic taste is a big problem. Lot of patients are complaining of the metallic taste. Has any one of you tried the metronidazole extended release preparation, which is coming in the 600 mg dose? Actually, I am using that. I am finding a very good results with that.
I am also using the same one tablet daily for 7 days.
Yes, madam, because that is a convenient also. Once a day we have to give. Yes, yes.
And it has less metallic taste also, definitely. Compliance is also good.
Yes, madam. Yes, madam. Thank you, madam. So now we have. Now, when we are saying that patient is suffering, sometimes the patients are coming to us that only a thin transparent discharge, but that is giving only bad smell. So what is your diagnosis? Fishy odor patient is complaining, and how you are going to start the treatment for that? Any one of you? I am taking the questions, whatever is coming in my mind. Yes,
only
yes.
trichomolar infection. Trichomolar infection, you have to treat both partners. And
Yes.
metronidazole, supportive treatment.
Yes.
That's all. I don't think any vaginal tablet is needed for that. Only metronidazole.
Yes. If there is a fishy odor, we suspect mostly for the bacterial vaginosis. So yes, as the madam told, yes, correct. Yes, Dr. Asha, you want to add something? Yes, darling, participate actively. Unmute yourself.
मैम मेट्रोनिडाजोल ही देंगे
हाँ.
और साथ में मैम प्रोबायोटिक्स भी दे देंगे.
Yes, very good. Yes, this is the. Now coming to the next question, there's because I have done. Okay. Which probiotic or yes, Dr. Rupali, your question. Yes, there are a lot of probiotics are available. Yes, vaginal probiotics are also available only from the one company, as I am aware. So vaginal probiotic, they are recommending to use for 7 days for the 3 consecutive months. From the 8th day of the cycle, आपको 7 days तक देना है, ऐसा 3 महीने तक दे, as of for 3 months, what they have reported. But I find somehow the oral probiotics are good. Renu madam, what's your opinion? Are you using vaginal probiotics?
I have still not tried vaginal probiotics.
Okay. The cost is also a big factor, and the temperature maintenance, because we all know India is a tropical country. Now it's okay. Now it's very cold. But after some days, to maintain that, to keep in the fridge is not always possible for the patients also.
Ma'am, we received one question.
Yeah.
1 minute, ma'am.
Yes. Hi, Rekha ji. Good evening.
So, ma'am, question is received by Dr. Rupali Jain. Are some vaginal probiotics available?
Same I have taken, na? Same I have taken.
Okay.
Same I have taken. Yeah. Okay. This is the only last question. Na? Yes. So now coming to the another discussion, very important point. How many of you favor the uses of the vaginal wash, and how many of you are against of that? Last week only, I have taken one webinar with the invited by the some society. So there is a lot of discussion, lot of controversy. I spoken on this vaginal microbiota and infertility. So I want to know each and everyone's opinion. Rekha ji, good evening. Welcome. Rekha ji, can you hear me?
Uh-huh.
Rekha ji, welcome. Good evening.
Uh-huh. Hello, Dr. Ritu. Thank you. I just, remembered, just because of your reminder, I remembered. Thanks a
Okay.
lot. Reminded now on the WhatsApp group.
Yes.
So
So today,
your talks are always very
yeah.
knowledgeable, but I always miss out, and I always think that I should be, remembering, because Dr. Ritu always gives very good take-home points.
Thank you, Rekha ji, for joining. Today we are not showing PPT. Today we are just doing the discussion, because this
Oh,
leukorrhea vaginal discharge.
that's very useful. Very useful.
Yeah, that is very common. So I am taking each and everyone's opinion. So Renu madam is with us. Renu madam has already given lot of insights to us. Each and everyone is participating. So I request to you also. So whatever is what you are using in your practice, so we are sharing that thoughts only. So now I have asked the question that how many of you are in the favor of the vaginal wash? If yes, then why? If no, then why?
Okay.
Huh.
So, and like, if you pardon me, can you tell me which vaginal you were talking about? Which vaginal probiotic?
Vaginal probiotic you want? Vaginal probiotic is
Yes,
coming.
tablet.
Brand name, how can I take in the show? I will write in the group if you want.
Okay. Okay.
I will write
Thank
in
you.
the South this your South Gynae group. I will write the brand
Okay,
name.
okay. Thank
So
you.
that is only by the one company which they are recommending for the 3 consecutive months from 8th day of the cycle for the 7 days. So
Okay.
now we are discussing regarding the use of this vaginal wash. Renu madam, are you in the favor of the vaginal wash?
I'm using it and it
Yes.
does affect.
Yeah, I am also using.
And it has a good effects also, because there is no harm in it using it.
Yeah.
They say that you should be using it when you are like doing an IUI, IVF cycle in the preparation part, because the vaginal microbiome will be more balanced.
Yes, see, they are the different, because these days a market is full of the different vaginal washes. So every day we are seeing in our OPD ki some or the another company person is coming that this vaginal wash or other. So usually the which is having a proper lactic acid bacillus, and these days are coming with the lactic acid bacillus with aloe vera, with tea tree oil, with sea buckhorn oil. So that all is good. I am finding good results. So usually I am advising to my patients. Yes,
We
Renu madam.
received one question from Dr. Neelam Jamnani. Ma'am, oral probiotic should be given ideally for how many days?
This is a very good question, Dr. Neelam. Hi. So Neelam, see, usually you are asking me for this leukorrhea treatment. So leukorrhea treatment ke liye, the literature shows that you can give up to 6 weeks, but 6 weeks no patient will take. So minimum for 15 to 20 days you should advise. What others say? Rekha ji, what your opinion? Renu madam, your opinion?
15 days. 15 days is okay. I usually give it for 15 days and the patient.
Yeah. So
but sometimes you have to give longer also, because patient comes back. So I think 6 weeks also we need sometimes.
Yes, that's also correct. Yes, because there is no harm in giving of the probiotics. If the patient can take, that is of course going to helpful, because lot of studies have come for the use of the probiotics. Here I can share also now the recent studies have come for the use of the probiotics in the male patients also. Recent study has been published in the PubMed that the giving of the probiotics will help in the improving the sperm morphology and sperm motility also. So it is useful in for the male patients also. Yeah, Dr. Devi has joined. Yeah, hi. I am able to see some more Dr. Ramya has joined. Yeah, hi. Welcome everyone. Dr. Neelam, you are from which place? Chalo, we can take next question till we are getting the answer. So now coming to the question, when we are saying that patient is suffering from the recurrent vulvovaginitis, lot of patients are coming na ki ma'am, till the treatment is going on, we are feeling good. And once the treatment is stopped, after that again our problem is started. So I think everyone is seeing this kind of patient in the OPD. Lot of patients are coming from, some are treated by some other doctor and telling us, ma'am, till the medication was going on, we have taken treatment 4 months, 6 months. So what will be the final option then? What we are going to do? Anyone can answer? Renu madam, start from you. No one is answering. Every time I have to asking the Renu ma'am. So Renu ma'am is guiding us, everyone. Yeah.
Renu ma'am, Renu
The
ma'am is
male
a guide
partner is very
all
important.
through. Always we look up to Renu madam only, Dr. Ritu.
Great, great. Yeah, Renu madam, starting from you.
One thing is the treating the male partner, number one,
Yes.
that is very important.
Yeah.
And sometimes I give prolonged treatment in the form of the antifungal on first day of cycle for 6 cycles consecutively. That also helps for recurrent vulvovaginitis and vaginitis, fungal vaginitis. And if it is a mixed type of vaginitis, so we can give the kids having secondazole, azithromycin, and fluconazole. These kits can be repeated every 15 days to both partners for 6 weeks or even sometimes 3 months. That I am using usually.
Correct, ma'am. Correct. Huh? So, how many of you you are in the favor of using the fluconazole, and how many of you are favoring the use of the itraconazole? Because so many drugs are coming these days. Earlier, when we are studying, what we are using, we are usually giving this fluconazole 150 mg once weekly or twice weekly. So now there are let me finish this, then I will take everybody opinion. So now there are a lot of studies have come. Some are using this itraconazole either 100 mg or 200 mg, and very recently the fenticonazole. Fenticonazole tablets have available. Vaginal tablets are also available. So how many of you are in the
After
favor
that,
of this?
laliconazole also.
Yes, luliconazole. Yes, ma'am, luliconazole. Yes, yes. So what you find, Renu madam, in your long time practice, what you found, still you're finding that fluconazole is good, or now you're finding this, the newer drugs, luliconazole and fenticonazole are good?
If the patient is coming for the first time and she is having infection for the first time, I prefer fluconazole.
Okay.
And if it is a recurrent infection, combination is also given, fluconazole with itraconazole, because itraconazole is fungistatic, fluconazole is fungistatic, and itraconazole is fungicidal.
Yes.
So I am using both. Then the first itraconazole for 5 to 7 days, then fluconazole once a week, then once a month itraconazole. This is my usual work for those cases who are having recurrent fungal infection, and male partner also at the same time.
Yes, 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 yes. Correct, correct, madam. Rekha ji, you want to add something?
Fenticonazole I have not used much, but fenticonazole local I have used.
Okay. I'm actually using the local application of luliconazole. I am finding very good results, because earlier what I was giving this for this Candid and Candid B, but these days I am only using this luliconazole. Fantastic results we are getting.
Fenticonazole I am using because it has to be used only for 2 days, one after 48 hours.
Yeah.
And then fluconazole for 7 days, that is definitely preferred. It is patient's compliance is not that, and then patient has usually discharged because the tablet dissolves in the vagina. So fenticonazole I have used, but laliconazole still I have not tried.
Okay, 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 okay. Yeah, good to see Dr. Alka Saini madam. Yeah, welcome. Dr. Rekha ji, is anything you want to add?
Yeah, I wanted to add, like, then also we give prebiotic, probiotic with all these medications.
Very good. Yes, yes, yeah.
Also one multivitamin, like some B complex.
Yeah, B complex. Yeah, yeah, yeah. Yeah,
and,
hi,
and
Dr. Shalini. Yeah, yeah, yes. Yeah.
Yes, and also they say that give like everything is in everything nowadays, but maybe it is all the pharma companies, but they say give vitamin D also, madam. So everything, it is
Of course, vitamin D so anyhow is helpful for everything these days. Every etiology, every disease etiology is connected with this vitamin D. So anyhow, most of our Indian population is vitamin D deficient. So giving vitamin D 2000 international unit daily or 60,000 unit weekly is not a problem. That is very easily, preparations are available. So we can advise. Yes, Dr. Neelam, yes, agreed to you. Yes, I am using the luliconazole local preparation only. With us, some international friends have also joined. So friends, what's your opinion? Dr. Frigura, what's your opinion? What you are using for treating your patients for leukorrhea? Are you using this luliconazole and fluconazole?
I'm happy because what you give, I also give. Vitamin D, itraconazole, everything I give. Probiotics. Yes.
Yes. Yes.
It works very good.
Yes. 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 Okay. Thank you. Thank you.
So Europe is the same.
Dr. Ritu,
global. Everything is global now.
Sorry, Dr. Figura.
Everything is global now.
Yes, everything is global. See, webinar has connected all of us so closely now, so we can discuss each and everything. Here, one very important point I want to mention: once we are treating the patient of recurrent vulvovaginitis or recurrent leukorrhea, very important, we have to ask the patient about the monogamy or polygamy. These days, lot of patients are coming which are giving the history of the multiple sexual partners. Yes, Rekha ji, you want to add something, na? Rekha ji?
No, I just wanted to ask. I wanted to ask you that luliconazole, has it got a vaginal pessary also or only ointment?
No, ointment. Ointment I am using. Ointment. Pessary I am not aware.
It is giving you good results. Very good
results. I am finding very good results. So I am, these days I have stopped everything. I am using this luliconazole vaginal. Oh, sorry, ointment. Yeah.
And I wanted to ask Renu ma'am also one question, Renu Bhatia ma'am, that like when ma'am you are giving this every month you are giving fluconazole. So for how many days?
No, not fluconazole, itraconazole.
Acha, not fluconazole.
Fluconazole the once a week. It should be given once a week. But for prolonged treatment, I give a itraconazole 200 milligram once a month for 6 months.
Okay, 200 milligram stat dose, ma'am.
Stat dose.
Achha, for 6 months every.
It has a good result for those patients who are having recurrent vaginal infection. They are that fungal infection.
So depending on the body weight, Rekha ji, 200 to 400 mg we are giving. If the patient is around 50-60 kg, 200 mg. If the patient is overweight, more than 90 kg, then 400 mg.
That the 200 BD can be given.
Yes.
Okay. Thank you.
Yeah, welcome. Dr. Chinwe, Iglo, you are with us. So you want to share something? What's your line of treatment? You are doing the same or any other thing?
Yeah, we're doing the same. We give fluconazole and then you can give another cycle, but I've never had about 6 months because the person is not a cancer patient and is not a HIV positive patient. So I'm surprised that you treat for 6 months. By the time you do 2 cycles and you take care of the partners, I think the patient is good to go.
Yes. I just want to add one thing, Ritu. It is 6 months only it is given if the patient is having recurrent vaginal infection or patient is diabetic. Then she is having recurrent fungal infection. Then we treat for 6 months. Not every patient, but otherwise we only to give fluconazole for 6 weeks. But for those patients who are having recurrent infection, then only every month we give, and that is only for 6 months.
Yes.
Patient is having diabetes also. So diabetes where recurrent infection is very common. I don't know about what doctor is saying, why we give for 6 months. So 6 months ka irrational hai.
Yeah. See, every time what is written in the books, we can't follow because the treating doctor is the best judge. What the problems which are suffering, which every patient is getting and how the patient is responding. So, of course, accordingly to that, we are treating. So now coming to the another question, suppose if we have given everything and patient is not responding to any treatment, then how to proceed? How to counsel the patient and how to proceed? Anyone? We had given everything. We have ruled out the diabetes. We have ruled out HIV. Any one of you don't want to go for the STD testing? How many of you have favor in the doing for this STD testing?
Yes, Dr. Ritu, it should be done.
Yes, yes. Yes, Asha, what you say? Dr. Asha, I'm able to see you. Unmute yourself, unmute yourself.
जी मैम मैम कराएंगे टेस्ट
Okay, okay.
जी मैम अगर नहीं ठीक हो रहा है तो फिर मैम कराएंगे साथ में जो है वेजाइनल सॉफ्ट कल्चर एंड सेंसिटिविटी के लिए
Yes, yes. Anyone else? Dr. Francisco, what's your opinion? Dr. Alka, you can also give your opinion. Dr. Shalini. Acha, chalo, okay. Those who are doing those. Yeah, hi, Dr. Shalini. How are you?
Good. Good evening. Yeah, definitely we'll go for the STS testing. So I think just to confirm the test which we would do, like VDRL, HIV, STS, which ones should we get done exactly? So this I would.
What you are doing? What you are doing?
So I get VDRL, HIV done. So that is.
So darling, how you rule out the mycoplasma, ureaplasma, herpes simplex?
That I don't know. So torch and all? Torch should be done?
No. Toxoplasma is not the etiology of this STD. Toxoplasma is not the etiology. Anyone want to give the answer for this?
Serology.
Sorry. Yeah, Pooja, Dr. Pooja, want to add something? Friends, see, we are doing the vaginal swab cultures for the different. I don't know in every city it is available or not, but as for the some, yes, for herpes simplex, yes, of course, the vaginal swab can be done. For ureaplasma, it can be done. For mycoplasma, it can be done. For chlamydia, it can be done. For Neisseria gonorrhea, it can be done. So depending on your patient's pocket, that how much your patient can afford. So of course these all are costly. अगर आपका patient कर सकता है afford, तो definitely we can go ahead for that. So I think one question has come. Okay, now coming to the, yes, suppose if your patient is not responding to the treatment, so then how to proceed? Patient has came to in our OPD 2 times, 3 times. Then patient is saying, no, madam, nothing, no result is coming. Then what to do? Then what to do? Patient भाग जाएगा यार, कुछ तो करना पड़ेगा ना.
Dr. Ritu, have you
Cryotherapy.
Yes.
Cryotherapy. Role of cryotherapy.
Yes, Dr. Nishan.
Dr. Pooja is saying cryotherapy.
Yes, good. Yes.
Yeah.
Anyone else?
Biopsy.
Biopsy, okay. Yes, anyone else? One doctor has given the option is the biopsy. Okay. Another has given the cryocautery. Yes, cryotherapy. Yes.
PRP.
Okay. PRP also good. Yes. Yes. Rest, what are going to do? Dr. Alka, Dr. Devi, what you're going to do? Dr. Neelam? Then why you have joined if you don't want to answer this session? Better leave. And why you wasting your night? Huh? Then what we are going to do if the patient is not responding to the treatment? Renu ma'am, you start please.
I don't know. Now the patient will change the doctor.
Yes. Of course, the patient will change the doctor. Yes.
You have done everything. If she's not responding, so she has to change. अच्छा रितु, ये जो बताया STDs, these are all available in India.
Yes, these are available. Yes, these all are available, madam. These all are available.
It should be most commonly used. If you are using it, which is most common infection you find?
I'm getting a lot of patients of this herpes simplex. Herpes Herpes simplex. So usually all the labs are not doing for herpes simplex down to in for that. Some doctor has told me just now for this torch. So in that instead of torch, you can do only herpes simplex, HSV1 testing.
Vaginal swab for herpes simplex.
Vaginal swab also, but some labs are not doing for the vaginal swab, so you can do for the blood also. But ideally, if you can do for the vaginal swab, that will be the great. For the ureaplasma is also it is available. For mycoplasma, it is also available.
Herpes simplex if IgG is positive or IgM is positive.
Ma'am, once we are doing from the vaginal swab, they are giving only the positive and negative. They are not.
You are saying that it can be done in blood also.
In the blood, of course, if the IgM, if IgM is coming positive, then only you have to give that treatment for this antiviral.
Yeah, definitely.
Yeah,
but
yeah.
That have a prolonged IgM is positive only for some days, and then it will be negative because IgG will be positive always.
IgG to always come positive. Yes.
Patient
Yes.
is having, and the patient has not responded to all the treatments. By the time the herpes simplex will be over, she will become immune to it.
Yes. Yes.
So just antiviral we have to give for some time. How many days? If you are giving antiviral?
I'm giving mostly for 15 to 20 days minimum.
Oh.
Anyone else want to add something? Dr. Chinwe, you want to add something? Good to see you, huh? Good you have on your camera today.
Yes. So
and thank you for joining. She's attending my webinar, I think, from the lockdown time. At that time also, I always read your name. But today I'm seeing you by face. By name, I recollect. Yes. Yes, dear.
Yes, which antiviral you give? Is it Zivididine or Zevarax? Which antiviral? And what viruses do you have in mind?
Zevorex is I am giving, but that also depends that how your patient is responding. So in some patients, due to antiviral, also a lot of side effects are coming. But some patients are tolerating, in which the culture, because here in Pune, no one takes antiviral once it is proved in the report. Here the patients, a lot of the Google say they read each and everything. Ma'am, if there is no virus infection, how you have started the antiviral? So yes, of course, we have to, on that basis only, we have to discuss. So now, one doctor has told that we can go for the biopsy. Okay. One has told about the cryotherapy. Yes, why not this electrocauterization? Yes, Pooja, you have answered the cryotherapy. Why not the electrocauterization? Patient will ask, na, ma'am, that why this electro and why this cryo? Rekha ji, you want to add something?
Like a lot of good points I am gaining. Just now I'm not in any position to add.
Achha, okay. This is just a discussion now. If
cryo surgery mein tissue damage is less, electrocautery mein tissue damage is more, and hence the patient can place of discharge after electrocautery. While cryo there is not much discharge. So that's why cryo surgery is preferred for. That is only for cervical erosion if the patient is having discharge because of cervical erosion. And if it is a vaginal infection, then I don't think this will affect.
Ma'am, here I will share you one very recent study. See, we all are, these days, lot of persons are coming with this cryo, different modules. Now cryo gun is available, cryo pop is available. So I think, and you all of us must aware of this cryo gun. Earlier, what happened that we are taking this nitrous oxide cylinder and putting for that. Now these days a gun is available which is having a carbon dioxide. So that is not like that ki itna bada cylinder we have to keep. Now it's a gun is available for that. So but yes, as they tell, for the electrocautery you have to dependent on the light. For the cryo there is no light is needed, and it is easily can be done in the OPD. But the studies now, there is some studies have come that by the electrocauterization, the results, some studies have come. I'm telling you very recent, this is 2021 data, that that by the electrocautery, once they have done the follow-up, that they find some good results in the patients of the who had gone in the via the electrocautery. So yes, I'm agreed with both. I'm doing both electro and cryo. I'm using the same nitric oxide viola cylinder what I am having. Yes, it can be done in the OPD, Pooja. It can be done in the OPD. Sometime I will make video and post in the group. Huh? So yes, that can be done. So yes, for the biopsies also okay. Any one of you like to do the colposcopy of the patient? Yes or no?
Yes, yes.
Yes. Yes.
Okay.
Yes.
Okay.
Because it gives you the opportunity to look at the cervix. You can see ectropion.
Very
That is
good.
the columnar epithelium coming
Yeah.
outside.
Yeah.
And the vaginal discharge will not stop until you treat the ectropion. So
Yeah.
you will see it as it's coming because it's light that is directed to the cervix.
Yeah.
And you can see and treat at the same time.
Yeah. Yeah. Very true. I think we will wind up for today because it's already 10. So tell me which next topic all of you want to discuss. Though these PPTs are ready, I can show anytime. So which next topic you want to discuss? And I think we will keep this in the discussion mode only. So that will be more helpful.
Very good. This discussion mode is, and we get a lot of good points. Discussion is more good. Acha, Dr. Ritu, one more point, like for ruling out tuberculosis, when the vaginal infection is very fussy, doesn't go, then I've
Very
seen.
good, Rekha ji, very good. I want that someone should speak this. Very good. Yes, yes.
When I started ATT for many patients, they responded, but they didn't respond with any of the other therapies.
Yes.
Because I went for investigating tuberculosis.
Yes, yes. Very nice. Very nice. Yeah, yeah. Very nice. So friends, tell me next week which topic you want to discuss. So we will take that topic and we can discuss that topic only.
Dr. Neelam is asking for menopause.
For what? Menopause topic.
Menopause.
Okay.
I support.
Sorry.
Yeah. Good. Menopause.
Okay. Okay. Actually, you support. Okay.
Dr. Shalini, PCOS medical management.
PCOS का आज ही मैंने इतना बड़ा सेशन लिया यार 7:30 बजे. Please go and see. आज तो मेरा गला दर्द हो गया 7 बजे से बोलते 7 o'clock only I have taken today. What a very good opportunity. I invited by Dr. KK Agarwal show. So there I spoken in the this PCOS.
Okay.
So okay, PCOS also we can discuss once. One option is menopause. Now, so friends, let's decide and finalize. So one topic, so everyone can read little bit and we can discuss next week. Something I will also learn, something you will also learn. So which topic we will finalize for next week? How many of you in the favor of the menopause?
Yes, menopause. Good. Menopause.
Menopause.
Yes, menopause.
Yes, please raise your hand. Yes, Dr. Devi for menopause. Dr. Chinmay for menopause.
Dr. Alka.
Okay.
Dr. Renu ma'am.
Yes.
HRT menopause. Dr. Pooja.
Okay.
Dr. Krati. Dr. Asha.
So let's panelize the menopause. Is that okay with everyone?
Yes, ma'am. I think.
So Sahiti make the flyer for the next week. Menopause from points to discuss. Nahi, we will take.
We will make some catchy.
You make some catchy. I will also think for the next Friday 9 PM we will be joining again. So friends, do ready with it. Sure. Yeah. Thank you, Sahiti. So yes. So most of the we are getting the thumbs up for this menopause. So let all read for the menopause and what are the practical queries we are having. So we can discuss on that day. I think instead of PPT, this is good. What you are getting in your practice and what I am getting. See, today Rekha ji has brought up the very important point. This is the tuberculosis. Similarly, the Renu madam has shared a lot of good things regarding the recurrent vaginal infection. So ये चीजें जो होती है ना पढ़ने से नहीं आती हैं. So once we discuss only, then these things will always remain in our mind. My purpose of starting this all academic groups and academic discussions, that of course that what the problems, what means when I passed out, at that time the net is not so strong. Now in this digital era, we can connect all across the geography. So we can get lot of friends and we can discuss and share our thoughts. So friends, so we will be winding for today and we will all meet on next Friday. Nishan, can you see the date? I think it will be 10th, na? Let me check.
1 minute, ma'am.
I'm
Yes, ma'am, 10th.
So 10th February, we are meeting at 9 p.m. We will discuss all about menopause. The topic is all about menopause. So whatever is the query regarding to menopause, when to start the treatment, when to stop the treatment, or otherwise some other catchy topic, if the Nishant is able to make it.
Sure, ma'am. I will try to.
So we will wind up for today. Friends, thank you so much, those who all have joined. So bye-bye.